My name is Kip Dye, a licensed physical therapist, and I'm here today to discuss techniques of self-myofascial release with a product line I invented called Thera-Roll. It's a ridged roller which allows us to specifically get into certain areas of the body to release those tight, knotted, kind of sore areas and increase mobility and promote recovery and performance out on the field or in the pool or whatever venue that you are particularly in. But what I like about the ridges is I can specifically release my hips. And the hips, I break them down into the glute max, which is the muscle that actually covers the whole entire kind of part of the back of the hip. The glute medians sit right about here on each side of the hips. And then the glute minimus muscles are out on each side of the pelvis. So it's a small muscle out laterally. And then the third, or I should say the fourth thing I'm going to discuss today is between the sacrum, the tailbone, and where the hamstrings attach, the ischial tuberosity. There's a large ligament that spans that area on both sides that we're going to specifically teach you how to release for your particular needs. If you're finding your hips are tight or sore, these four areas, if you release them on a regular basis in an effective level, you'll find you'll feel much better. You'll just move so much better day to day. So the first thing I want to do is just place the roller on the floor and you sit up on the roller. You can lean back for support through your hands. What I do initially to warm up is I'll bring my leg kind of out from midline, relax the hip right over the ridges of the roller, and I'll just roll back and forth to kind of warm up the tissue, because there's friction between the ridges and the soft tissue which generate heat. So I'll kind of warm up the tissue, and then I'll find areas that are knotted, and I'm finding 3 or 4 good areas that I can demonstrate how to release. So what I'll do is I'll do that for a minute or two, and then initially what I'm doing is I'm releasing the glute maximus. That's kind of the general warm-up, because the muscle spans the whole outer back of the hip. But then I'll get more specific. I'll go halfway out, and I'll support myself with my hand and with my opposite foot. And then I'll use this hand to support this leg to guide the position I need my body in to get different aspects of what would be more the glute med or medius, which is out about halfway on the hip, as I said. And that's very effective. Now, keep in mind, when you're elevating your knee, you're exposing more so the sciatic nerve, which passes down through the back of the hip area. So if it's overly sore, you may want to back off that angle, you don't want that angle to be too great through the hip. And then as you release, then you can gradually lift up into a more aggressive angle position and get really, really deep. And you can also use a cross-friction technique as well. And then the third and final aspect of the glute, which is the glute minimus, you want to lie on that roller just very much out on the side, and you want to work between the point of the hip and the top of your pelvis. Do not work on the point of the hip, which is the greater tubercle, the greater trochanter. You want to stay off that greater trochanter, and you do not want to roll over the trochanteric bursa. It's a little fluid-filled sac underneath that point of the hip. So what you want to do is you want to stay right between those areas of the upper part of the pelvic bone and the greater trochanter. And what I'll do is I'll get in there and do some cross friction, and then I'll just kind of roll, and then I'll use both hands, and I'll get deeper in there, and I'll just kind of work the teeth or the ridges of this roller deep into the soft tissue. Another thing I can do is I'll elevate the lower leg, and I'll just kind of use some rotary active motion, and I'll even lift the leg off the table or off the floor in different positions, and that allows me to get different fibers and a much more comprehensive release of that particular muscle area.